have a complaint of low libido, and I'll say, well, how's your libido when you go on vacation? Like, oh, well, it's great. It's like, well, it sounds like you have a stress problem and not a hormone problem or a libido problem. The next question is, what effects do birth control pills have on a woman's hormones?
Depends on the birth control, but the combined oral contraceptive pills, which we call COCPs, they have a synthetic estrogen. There's more than just one now, but the most common one is ethinyl estradiol, and then a synthetic progestin, which is a type of progestogen that is usually made from either an androgen or from spironolactone. I think they have 4 generations now, but they have multiple different generations, and within each generation of progestins, they have slightly different effects on SHBG and platelets and even venous thromboembolism risk. And a good rule of thumb is COCPs are basically just synthetic HRT. So if you're on COCPs or you have been on them, then you've actually been on hormone replacement already. It's just with synthetic hormones. They are neither good nor evil. They are particularly helpful, especially if contraception is something that would be a very positive benefit in your life, which often it is.
Yeah, family planning is very important for sort of setting up your blueprint for life and how you want to go about things. And I think a topic that is coming to the light more now, and I know you and I have discussed, is the effects on androgens from combined oral contraceptives. And I've seen it both ways in blood work, where sometimes there's a normal testosterone level, normal free testosterone, and sometimes where it is virtually undetectable because that ovarian function is very suppressed and maybe there's not a lot of adrenal reserve producing DHEA.
We like to have normal androgenic activity. So COCPs will replace your estrogenic and progestogenic activity, but they will not replace your androgenic activity unless somebody has a birth control pill, which maybe they will at some point, that has a synthetic androgen in it. That would be particularly interesting.
Or even a bioidentical androgen in it.
Or a bioidentical androgen. That would still be interesting, but not as interesting.
Just 1 milligram of oxandrolone to balance things out. And then the next question is, why does testosterone work for libido in some women but not others?
Testosterone is just one of the many vectors for improving libido in women, and actually the same is true of men as well. Could be their dopamine to serotonin ratio, could be their progesterone, could be their estrogen, could be too high, could be too low, and it could also be social factors as well. That seems to be the most powerful one for women.
Yeah, and the social factors, one of the things that I talk to people about is stress, because a lot of people, they'll have a complaint of low libido, and I'll say, well, how's your libido when you go on vacation? Like, oh, well, it's great. It's like, well, it sounds like you have a stress problem and not a hormone problem or a libido problem.
Yep.
So finding ways to manage your stress is also important.
Yep. Children can also play a part. They're an important vector for libido in women as well.